Vishnu Shom joins us on our top story this afternoon. Sources are telling NDTV that the Army base hospital in Delhi is now running short of oxygen. Vishnu is live with us. Vishnu, what more can you tell us? Has the situation improved since we broke the story?
Well, the situation we are told is it's a difficult situation, but one that they're trying to control, number one. Number two, they're not running out of oxygen in the next couple of hours or anything of that sort. Thirdly, they're in the process of sorting out the entire issue. So this is not equivalent to the situation that we have seen in hospitals in other parts of Delhi where there has been this crisis of air running out. It's not down to that as yet, and hopefully that situation will be sorted out. However, it is important to state a couple of points over here. That this base hospital in Delhi, which has 650 beds, is running at capacity, number one. Number two, that is because the number of infections of armed forces personnel, Army, Air Force, Navy, Coast Guard, is fairly high at this stage. It, in a sense, replicates what we are seeing in the rest of our society. 200 armed forces personnel getting infected. Our sources tell us with Covid-19 daily. So therefore, all of the bases of the armed forces across the country are full, trying to deal with serving members of the armed forces or their families or those who are retired personnel as well. That is their mandate. This comes, of course, at a time when the armed forces are very heavily involved in trying to reach out to the civilian side. They've lent doctors, for example, at the large DRDO hospital over here, facilities in Ahmedabad, some others in Maharashtra as well. However, it is still unclear whether they would be able to set up a massive hospital facility, fully oxygenated, as has been requested by Manish Sisodia, the Deputy Chief Minister of Maharashtra. That is a request of Delhi, I should say. That is a request that has been put into the office of the Department of Military Affairs, in other words, the Chief of Defence Staff, General Bipin Rawat. But our source is telling us that given how stretched the armed forces are as far as their own medical capacity at the moment is concerned, that's going to be difficult. However, they are looking closely at it and will obviously let us know if there's any change.